Good evening, guys. I'm Dr. Rosalyn George, for those of you who don't know me. Thank you so much for joining me for my very first webinar on Genevieve. And basically, we've been building collagen in people's faces and really in their bodies in our office for quite some time. And so now we have the ability to boost collagen in other areas of the body. And this is a product called Genevieve that we've had in the office since about August. And I have to say I got it for selfish reasons because I was having some of the issues that we are going to talk about tonight. And I heard really good things about this company and about the science that they had behind it. So that's really why we started offering this procedure. So the first thing I'd like to do is do a poll to see out of our attendees kind of what are some of the things that boosted you to want to join this webinar, some of the issues that you might be having. So bear with me here. All right. So in the poll, let me find my polls so I can read it. Have you ever experienced the following? Leaking urine when you cough, laugh, or sneeze, passing air from the vagina, feeling of looseness during intercourse, decreased sensation during intercourse, or ever that feeling of having your tampon slip? Just give this a few seconds here. I think that's pretty good. That's about. So can we share the, so I'm going to share what everybody is seeing here. So you can see 78% leaking urine when you cough. I was one of those people, I remember watching my mom in the grocery store growing up, and she would sneeze and she'd have to cross her legs really fast. And I said, what are you doing? Well, because she didn't want to pee herself. And I thought, well, that's never going to happen to me. You know, I'm never going to get old. That's not going to happen. And of course, I had two children. They both were around 10 pounds. And I noticed that I was having trouble, had to cross my legs when I sneezed. If I was doing things at the gym, that I was having those issues as well. Passing air from the vagina, about 33%. Feeling of looseness during intercourse, 44%. And decreased sensation during intercourse, 78%. And I think that those are really big issues that we don't talk a lot about. We've had Viagra for men for years, but women's sexual function has not been something, it's kind of just been pushed aside, something, oh, well, we just have to deal with, we just have to, that's just part of the aging process. Things just change. And it's nice to know that that's not necessarily the case. That's good. Let's go on back onto the procedure, and I might do another one in a second. Okay, so let's get started with the procedure, with the presentation here. So that's me if you haven't seen me before. Actually, I had to change the picture because the other one I looked a little bit like Jabba the Hutt in. So this is a much better picture. This is how I really look in real life. So we appreciate you taking a few minutes from us, from your house, to kind of hear about this. And I said, this is the year of the woman. There's so many changes. You know, we're not allowed to be harassed anymore, or sexual harassment is becoming a big issue. And I think that people are really taking notice that we are an important part of society as well. And so finally, there's something that we can do to help build our happiness and our satisfaction, and that's Genevieve. So one of the coolest things about this company is the CEO is actually a woman. So a lot of this was designed by women, for women, to benefit women and improve our health and quality of life. So I think that's a really, really cool differentiation. I mean, we know the numbers. There aren't a lot of women who are owning their own businesses and are in CEOs of companies. So I think that that's a really important part. So basically what this is designed to do is to help vaginal laxity. It can address stress urinary incontinence, and it does it unlike any of other devices out there, and we'll get to why this one is different later on. So here's where it can help. It can help with urinary incontinence. It can help with discomfort or pain during sex due to lack of lubrication, which, as I've talked to patients since I've had this, is really a big issue, the lack of lubrication. And a lot of people are having to use hormones to help vaginal atrophy as we age. So that laxity, loose feeling. And then that all leads to diminished sensation, and it might I've talked to so many people. I never thought of even talking to patients about this before. And this is such an important part of our relationships in our lives. But when you have, no lubrication, you're not having any tightening in the vagina, you have problems with intimacy, maybe inability to climax, and that's a big issue, and it can cause a lot of issues in relationships if you're not as into sex anymore because you're not enjoying it like you used to. All right, let's do another poll question. How would you rate your current level of vaginal laxity? Very loose, moderately loose, slightly loose, moderately tight, or very tight? All right, I think that's good, 80%. That was a good response. All right, so you can see this is the polling results. So, this is an issue, and that's maybe why a lot of people who are having this issue are joining this webinar tonight. But a vast majority, over half people are, having some sort of looseness. So 70% very loose, 42% moderately loose, 17% slightly loose, and then we have our overachievers that still don't have that issue. But it's one of those things that you can see just by our poll is actually a big issue. All right, so what is Genevieve? I don't know how much people know, so I'm going to kind of give you the rundown. It's basically radio frequency, and it's a 30-minute procedure with very little downtime. And the only downtime there is there's 48 hours where you can have no vaginal insertion. So you can't wear a tampon and you can't have intercourse. You can't use a douche. Can't put anything in your vagina for 48 hours. Patients usually describe the treatment as a warm, tingling sensation. When I had it done, I honestly could have taken a nap. I had no discomfort whatsoever. I did have a little bit of a warm, tingling sensation right at my episiotomy scar, but other than that, it was so easy. And the only thing is afterwards, you do feel like you're that tiny feeling where you might be getting a urinary tract infection. I did feel that for that first night. But other than that, it was super easy, and I could return to all of my normal activities very quickly. All right, so what do we see when you have a Genevieve treatment? You can notice an increase in lubrication as little as 4 weeks. And the patients we've treated, that's generally what they notice first. And that really is about 4 weeks. The full results are seen around 3 months, and that's increased lubrication, increased sexual sensation, improvement in vaginal tightening, and decreased stress urinary incontinence. It's very funny. I have a nurse who is in her early 60s, and we're doing the training on this device. And she goes, well, I don't really know, I don't really have problems with my sex life. I don't really know if I have any vaginal laxity. And she's very open with all of this stuff. And so I said, well, you should probably still just have the treatment. I kind of wanted people to have the treatment so they could explain it to patients and make sure that they were seeing the results. And so she had the treatment, and probably about 8 weeks after, she knocks on my office, and I'm like, what's going on? She says, I believe. And she's whispering really low, I believe. What do you believe? What do you believe? She's like, I believe in Genevieve. So, all of these things are, and it was something that she had never thought she had an issue with really, and it was that significant and an improvement in her sexual satisfaction. Again, lubrication is the first thing you see, and then all these other things take about 3 months to see the results. How soon can you exercise again? These are some just frequently asked questions. I exercised, I think, the next morning. I've been doing Orange Theory, so I get up at 5 a.m. and do Orange Theory, and I had no issues whatsoever. And like I said, the only thing is 48 hours. You just need to abstain from any intercourse or insertion of anything into the vagina. So who is not good for Genevieve? Anybody who has a prolapse behind outside of the vagina. So if you have a true prolapse, that's not going to help this, and we wouldn't recommend this treatment. Anybody who's currently breastfeeding, anybody who has large metal implants, implanted mesh, or prior pelvic sling surgery, and anybody who is currently having or have had chemo radiation therapy within the last 6 months. Now, after that, that's completely fine to treat, and I actually have had several patients who had finished breast cancer therapy and wanted to have the treatment. You know, they'd been out years from having breast cancer treatment and still had those chemo hangover effects. So at that point, it's completely fine, but we like to make sure that everything's clear for 6 months. I also think it's a good idea to have had a normal pap smear just to make sure and have had a check with your GYN just to make sure that everything is normal. So how long does Genevieve last? In their clinical studies, they went out to a year, and that's basically, clinical studies are extraordinarily expensive to run. So most of them last at the most a year. And at a year, 90% of patients were still completely satisfied with their results. And that's actually a really, really big number. A lot of people will get on a website called Real Self, and you can see of all of the cosmetic procedures, 90% is really good for somebody, for a procedure. And as I've had experience with other collagen stimulating devices, Ultheras, Infinies, Thermage, those types of things, most people will see some effects for 2 to 5 years out of treatment before they may want to touch out, because our bodies unfortunately continue to age. So it's not permanent, but very long lasting, but will require touch-up treatments down the road. So why did I choose this particular procedure? There were lots of other ones out there that actually had better brand name recognition. But if anybody is familiar with my practice or has been here before, I'm very results focused, and I wanted to be very clear that I had the best procedure that was going to deliver the best results, because the last thing I want somebody to do is spend a lot of money on something and not have it work. That's just the worst feeling in the entire world. So basically, this is cryogen-cooled monopolar radiofrequency, and that's a lot of science mumbo jumbo for a lot of people. But basically, what that's saying is that it cools the top layer of skin, and by doing the top layer, cooling the top layer, the energy can go much deeper into the skin without damaging anything. So the depth is about 5 times deeper than some of the other RF technologies. The other big thing about this is it's standardized. One of the other ones I looked at was basically this little wand, but the wand couldn't stay in the same place because the heat would actually burn somebody. So you have to kind of go in and out and make sure you get the whole area, and it just seemed very uncomfortable, and it also seemed like something where it was very operator dependent. And when things are operator dependent, if you don't get the right person using the device, you're not going to get the results. So that was a big deal to me. The other thing is that this company is investing in the science. So they've spent a lot of money actually developing optimal treatment plans. Since I had gotten it in August, the company came back and retrained us because they came up with another way to treat stress urinary incontinence. So I like the fact that they're investing in the company and they're doing it in a way that they're supporting it by evidence. The other thing, it's a single session. All of the other ones are multiple sessions. So, you know, you come in once a month for 3 sessions and hope to see results 3 months after that. This was a single session. It has a really great safety profile, and it was completely comfortable. You don't require any anesthesia. It's very convenient. And it is actually approved in Europe for vaginal laxity, which is a big deal. They actually did the studies on that, and they actually did the studies on sexual function, whereas most of the other devices, and you'll see here, is that the FDA indication here is for electrocoagulation and hemostasis, and that's just a nuanced way of getting things through the FDA in the United States. But it's nice that they actually did the science to show that the things that they're claiming actually do occur. So why do we love Genevieve here? I think we talked a lot about this already. Say goodbye to stress incontinence. I would say 6 weeks after I had it done, I noticed a huge difference. Is it 100% I never have an issue? No, but it's 95% better. I would go to the gym and I would see jump squats and pump squat jacks, and I think, oh my gosh, am I going to pee myself? Make sure I wear black pants so that if I pee, they don't see it. Running, I went running in the mountains with my husband this summer, and I had to stop a bajillion times to pee because I was afraid I was going to pee myself. I don't have any of those issues anymore. Number 2, it only takes 30 minutes, very, very comfortable. It helps people of all ages. We've treated, the oldest lady we've treated is 77. So we've had women of all ages, of all races, of all sizes. It doesn't matter. This benefits everybody. It only requires one visit. Speaking from experience, I selfishly bought this device because of the stress incontinence thing. And I was extraordinarily pleased at the other benefits that I didn't think I had a problem with, but that now that I know, oh, having kids really did affect vaginal lubrication. It did affect sensation of sexual experience. All of those things are so much better. So it's been an extra added bonus to see those things happen. All right, should we do another poll question just to, let's see, let's pick a good one. I'm going to do two. Let's see how much the urinary frequency bothers you. All right, if you're experiencing urinary frequency, how much does it bother you? Not at all, a little bit, moderately, greatly, or I don't experience frequent urination. Yeah, so everybody's bothered by it most, you know. Nobody's really not bothered by feeling like they have to use the bathroom all the time. Okay, let's do, if you're experiencing urinary leakage, how much does it bother you? I imagine this might be a little bit more if you're actually having those issues. All right, again, yeah, I would assume that it probably bothers most people. Okay, and then let's do one more. Let's do, has the feeling of looseness affected your, and this is just one thinking about, you know, some of the changes, and I'm going to say looseness, but I'm going to just say any of the changes that we talked about. Has a feeling of looseness affected your interest in being intimate, engagement during intimacy, mental arousal, physical arousal, ability to reach climax? Yeah, so a large percentage of people. I have to say this is one of those things, about roughly 75% are saying that yes in the poll. This is one of those procedures. A lot of times people will come into my office and they will be having a procedure done and they're spending some money on it, but you know, they have their jar of money they've been saving. Then they're going to put a little bit on their credit card. Then they're going to put a little bit, you know, on a payment plan. This is one that I have to say, you know, partners are on board with. So feeling more comfortable in yourself and feeling more comfortable to be able to be intimate with your partner is a huge, huge part of intimacy and just a relationship in general. And so I find that partners are really on board with this for their spouses. Should I ask if there's any questions or? All right. And I think that if you have any questions, we can pull those up. Somebody's just saying hi to me. Hi. And this is actually a patient who had it. So definitely worth it having their first child. You can read this, but the procedure was not painful. I think everybody's a little bit afraid because I do tell people, oh, it's not going to be so bad sometimes, and I might tell a little white lie that it is going to hurt a little bit. This honestly really does not hurt. So patient has noticed improvement in all the things that we talked about tonight. So one of the best things about our office is that we offer a complimentary consultation. So if anybody is interested in this or wants to learn more about it, we'll be sending you an email and you certainly can schedule. Another great thing about this office is everybody is female, so it's a really safe zone. We talk about this stuff all the time. I think everybody does. My husband is always like, you girls talk about sex all the time. And so he's like, my friends and I don't sit around and talk about that stuff. And I think that just shows what a big issue it is. And somebody's asking what the cost. The cost is $3,000 for the treatment, and it's just one treatment. And this is just the contact information if you have any more questions. Thank you so much for joining us, and we look forward to hearing from you.